In the studios of WNTI with me this morning, I have John Hampilos, and he is the owner of Little Brook Nursing and Convalescent Home. But not only is he the owner of Little Brook, he's also on the board of directors of the Medical Society of New Jersey, the Institute of Medicine and Public Health. And we are here today to talk about a very important topic for, almost hate to say it, but folks in my age bracket, in that 50-year-old age bracket, we're going to talk about long-term health care, not only for yourself, but for, we are that sandwich generation, as they call it. We're still taking care of children, but we're also looking to take care of our aging parents on top of that. So long-term care is a very hot topic right now and something that you may not know too much about. So that's what we're going to touch on today. And John, welcome to WNTI. And why don't we
Thank you,
start
Melanie.
out by touching on what exactly is long-term care?
Thank you, Melanie. If you look at the definition, the standard definition, the present definition of long-term care, it's essentially the provision of services, both medical and non-medical, for people who have chronic illnesses or disabilities that are not just short-term but long-term. And that definition of long-term care, as we see it, will change over time. Presently, it's around-the-clock care for individuals. And by care, we're not just talking about assistance. We're talking about care in the broadest sense, whether it's for their health needs or for their hygiene needs, and for basically every other need that they need assistance with throughout the day. It is not care that is provided by just one person. This is care that must be provided by an assistant, a nursing home, certified nurse's aide assistant, for example, a nurse, a physician, a physical therapist, a dietitian, and even a chef to prepare specific meals, because many of the people who are eligible for long-term care suffer from cardiovascular diseases that have low sodium or salt intake requirements for their diets. They have diabetes, a prevalent escalating disease itself, and they have other conditions that require specific tailored practices of care. So that's how we see long-term care presently, and we see that evolving in the future.
Now, I do know there are insurance programs out there to buy long-term care insurance. And we're not here to sell insurance to anyone, but I don't even think there are a lot of people that realize that you can have a policy like that for yourself.
There are policies. Some are very comprehensive. Others cover the bare daily necessity and costs. In the United States, I would say the average cost for nursing home care is anywhere between $75,000 and $125,000 per year. Some of these insurance programs may cover up to $125,000. It's been my experience that most do not. That doesn't mean that they won't evolve, that these policies won't evolve to address the needs of every individual. But presently, many people do not have such coverage.
Mm-hmm. So what steps would you recommend people take to prepare for long term?
Well, I think coverage is one. Saving, obviously, a nest egg is another, albeit it's very difficult in this day and age to do that, especially since what we've been through with the Great Recession. But people must continually set aside some monies to do that. Most residents who have assets usually have some funds set aside. They have investments in properties, in personal items like automobiles and jewelry. And typically those are liquidated prior to entering a nursing home. But those monies typically don't last more than several years, if at all. And people must rely on the state, in this case, the Medicare program, which is very favorable, in my opinion, in providing monies that will allow individuals to continue with the type of care that they may be receiving in a long-term care nursing home facility.
So what are the kind of what type of care could someone expect at a long-term care facility? I mean, I know there's different types of facilities, but what in general should kind of care should there always be? And maybe what are some of the red flags that people should look for if they do indeed have their one of their loved ones in a long-term care facility and they're kind of not getting a good feeling about it?
That's an excellent point. I think people have this perception that nursing homes are basically, catch-alls for the aging, the elderly, the frail, the disabled. Those are perceptions of the early 1900s. There were issues over a century ago with the elderly being housed in homes and in cramped quarters and not being treated well. But with the Hill-Burton Act of the 1940s, 1946, this began to change where the federal government stepped in and began building or encouraging the building of institutions associated with hospitals. And that's why you see many institutions today, many nursing home, nursing care facilities that are very shoebox and institutional-like, narrow corridors, white painted hallways, just places that none of us really enjoy visiting. But since then, there has been a new genre of nursing home, one that is more home-like and really less institutional. These homes typically have all the amenities and technologies of a hospital, but they're behind the walls. They're more comfortable in setting. They have living rooms and dining rooms, and the bedrooms are more bedroom-like, so that the resident can feel more at home and more as part of a family than part of a hospital institution. And I think that as we, myself included, began looking at places, facilities that our parents or people were responsible for would be comfortable in and safe in and healthy in, we should be looking at what I call the 6 points of care. And the first one is clean. When you visit a facility, the residents there should be, clean in appearance, very, well made up, having, been bathed, and hygiene is at its highest standard. Not only the individual, but also their room in which they reside and the overall facility. Typically we expect carpeting throughout facilities. Carpeting is very dangerous for people who are somewhat ambulatory or not ambulatory. It's very difficult for residents to walk through a facility with carpeting when they're using a cane or a walker or even a wheelchair, and it can cause problems. Also, carpets tend to harbor, dirt and smells, et cetera, that are very difficult to clean. But the environment is very important. If it smells, chlorine-like, that's kind of an indication that there's, hiding of smells. If it smells like someone's baking bread that's coming out of the kitchen, that's very appealing. Not only for the families of the residents, but for the residents themselves. They love to smell freshly baked pies or freshly cooked meals. So I think cleanliness is important. The other point of care is assisting. Is there, 24/7 assistance there? Every resident and every family of residents or a power of attorney of a resident should expect that there is assistance with everything, not just one aspect, and that, and especially with the activities of daily living, hygiene, bathing, dressing, eating, ambulating, walking toward a social event or an activity. There should be assistance constantly. And even in the middle of the night, if a resident wants a snack after watching Letterman, the Letterman show, they should be, able to, call on an assistant or a nurse who's on staff to ask them, may I have, a gingerbread cookie and a glass of orange juice or something. It should always be available. The third element of care is love. And these are not in any particular order here, but the resident and their families and the power of attorney should be listened to at all times. They must be respected. If they like a certain thing or don't like a certain thing, that should be shared with the staff, and the staff should make accommodations for that. These, facilities that I'm talking about, have to have tailored assistance for each resident. Every resident is not a cookie cutter resident. Every resident comes with a rich, life history that needs to be respected. And residents need love, whether a hug from an assistant or a hug from a Girl Scout and a troop that's coming, or even just a simple gaze in their eyes. Love is very important for all of us, and especially our seniors in their golden years. The fourth element of care in my list is activity. Residents must be active, not just physically active, and they should be up and about if they can be taken out of a bed. And some residents are not ambulatory, but most should be. But mental activity too. They should be challenged, whether it's a simple chess game or a history, lesson from years gone by, or even, talking about recipes that they may have used in cooking for their families. And also verbal and social activity. Residents need to socialize. They should not be lined up in hallways or in big gathering groups just sitting, staring at the wall or staring at TV, but they must have activities, daily activities, whether it's bingo or painting a mural or being involved in an activity with Boy Scouts that might come in. This is very important. They should not be sedated and in beds or sitting in wheelchairs doing nothing. That's unhealthy and clearly one of the red flags. Being safe and comfortable, safe from falling, whether they're in their beds or in their wheelchairs or just sitting in a living room. Care must be taken to provide them with the necessary tools like a cane or a walker or a wheelchair that a resident can ambulate in or call on an assistant for help. They have to have a safe environment. Residents like to walk around. They like to wheel themselves from one place to another. There should be no transitions or steps or carpets to hinder their access to certain areas in a facility. So safety is one of the top points of care. Health, being healthy, looking healthy, not looking frail or gaunt, but being served meals that are really appetizing and tasty. They smell good, they look good, and they taste good. That's very, very important because drinking and eating is one of the essentials to extending life and to living. And so meals shouldn't be institutionally prepared meals that everybody gets. They should be tailored to the individual. If a person has diabetes, they should be low in sugar. If they have heart disease, they should be probably low in salt. So tailoring of meals. Medicines should be administered on a timely basis. It's important. Many residents come to us with heart disease, and they need to take their medications for high blood pressure or for heart failure, or have diabetes. They need to be tested. Their blood tests should be done, specifically as requested and directed by the physician, by the medical director on staff. And nurses should be always attentive to the needs, the health needs of every resident. And last is comfort. Residents must be comfortable, whether they're in their beds and being tucked in for the evening or being dressed in the morning. They have to be, very comfortable in their environments. If it's too cold, raise the temperature. If it's too warm, lower the temperature. These are, all important elements that we as, responsible parties for our parents and loved ones should be looking for. And again, the list is clean, being assistant, being loved, active, being safe, being healthy, appearing healthy, and being in a comfortable environment. So
that is a lot of great information. And again, to remind the listeners, we're talking today to John Hampilos. He is the owner of Little Brook Nursing and Convalescent Home, which is in Califon, New Jersey. And he is also a board member of the Medical Society of New Jersey, the Institute of Medicine and Public Health. He's on the board of directors. And we've been talking about long-term care. And, you were talking about the smell of baked bread and pies and all that. And it reminded me of, I had an aunt who has long since passed, but she was in a long-term care facility, and it was run by the Polish National Church. It was up in Pennsylvania. And once a month she would they would welcome her into the kitchen, and they would have pierogi day. And she would show the other women how to, whether it be relatives of other residents or the people that work there themselves, and she would show them how to make the proper pierogi from start to finish. And she did that when she passed away. She was 99 years old, and she made pierogi up till right before she passed away.
Yeah.
And, it's just one of those things where she was allowed that. And that made her feel, like she was really at home.
Right. And that's really critical. I think when residents come in and they are taken in as part of a family, they typically lead longer lives and happier lives. And that's important because these are not residents who are assisted by one person a day for an hour a day. These are residents who are there for a reason. And the typical life expectancy, could be anywhere from 2 days to 12 years in a nursing home, and on average it's 2 years or so. And these should be happy years. Our residents have worked hard through their entire lives. They typically are on average 85 years of age plus or minus. It ranges from as far down as 55 years old, as high as 105 years old. But on average, 85 years of age. They've worked very hard. And these, golden years should be, some of the best in their lives. And we try to make them as comfortable and as safe and as happy and as cared for as we possibly can. And part of that is being involved in preparing meals, or even toasting bread, as a
Right.
late afternoon or late morning snack, for example.
Yeah,
That
or
they have
having
toaster.
a knitting circle or a sewing circle, or anything
Exactly.
like that, cross stitching.
Exactly. Or if we have a veteran in the group, we celebrate on Veterans Day,
Yeah.
their accomplishments and contributing, to the safety and security of our nation, and recognizing that, because everybody comes to us with a unique history. And it's important to know that history and to share that with everybody else in the facility, not just the other residents, but also the employees. The employees are like family members. They get very close to residents over a 2-year plus period, and they get to know them on a very personal level, know the families on a very personal level, and that's important. And this is something else that families of residents need to look at, and that is looking at a facility. It's very easy to be lost in a 500-bed facility, less so in a facility that has fewer than 100 people. And that's because the staff gets to know everybody in the facility, and the families get to know the staff very well, and it just makes for an all-around happier experience for the resident. And that's what we're all there for, is for the resident.
Well, John, thank you so much for sharing this information with us. And before we say our goodbyes, please tell the listeners about the free and open to the public seminar that you have coming up on aging and memory loss, from forgetfulness to Alzheimer's.
Sure. A physician here locally at Hackettstown Medical Center, Dr. Sandy Seagram, who's in geriatric medicine, and I will be hosting and presenting this seminar on aging and memory loss. And this will be held on Saturday, March the 9th, from 3:30 to 5 o'clock p.m. at the Little Brook Nursing Home in Califon, New Jersey. If our listeners are interested in attending, please call Mr. John Casarda, who's the administrator of the nursing home, at 908-832-2220, and ask for him to reserve a place, because seating is limited for the seminar. We think that this is a very worthwhile effort. Alzheimer's and dementia is increasing, at a rapid pace, from presently 5 million people who are suffering from some form of dementia in the U.S. to over 15 million over the next 30 to 40 years. And it is going to become one of the most prevalent diseases among our age group. And we think, from a policy perspective, it's important to make this aware to people like ourselves, who can influence and have an impact on the policy for Alzheimer's in the United States. And I was happy to please that President Obama did mention Alzheimer's in his State of the Union address on Tuesday. And I hope that our listeners will take notice of this and other central nervous diseases, including Parkinson's and depression and anxiety, and take measures to become involved in policymaking in the United States.
John, thank you so much. And we'll have some periodic updates because I know you do these seminars and such every so often. So we'll let the listeners know what's happening with them as they come along. Thank you very much.
Thank you, Melanie, and thank you to WNTI.